and we will talk about stroke. Stroke occurs when the blood supply to a part of your brain is interrupted and reduced, depriving brain tissue of oxygen and the nutrients that it requires to function. It is a medical emergency and prompts uh, immediate medical attention. So there are different types of strokes, and I'm going to tell you a little bit about those. So there's a hemorrhagic stroke, meaning there is a blood vessel that bursts and causes bleeding in the brain. So this is hemorrhagic. So hemorrhage, remember, is blood, something to do with the blood. And then another kind of stroke is ischemic stroke. This is caused by a blood clot, and then the blood supply to an area of brain is shut down. So this is called ischemic stroke. Remember, it doesn't matter what kind of stroke a person is having, the consequences are bad. So whether you have ischemic stroke or hemorrhagic stroke, symptoms are pretty much similar. Stroke is the leading cause of death. It causes serious long-term disabilities more than any other disease. 75% of all strokes occur in people over age of 65. So remember, age becomes a risk factor for stroke, and risk of having a stroke more than doubles each decade after the age of 55. More than 800,000 strokes occur each year in this country. Following a stroke, patients are at a high risk of having a seizure depending on the severity and the damage and location to the damage done. So how do you know if the symptoms that a patient is having could be due to stroke? So when somebody has a true stroke, there is an inability to move a part of the body or a side of the body, problem in understanding or speaking, dizziness or loss of vision on one side, or all of these symptoms. So this is a little bit trying to teach you about the symptoms and signs of stroke. All of a sudden, a person can have sudden trouble in speaking, meaning you know what you want to talk about, but the words don't come out right. Sometimes a person can have slurry speech, and sometimes, it's called aphasia, you just can't say anything. Sudden trouble in walking. Remember, I told you that one side of the body may be affected. So if you have weakness, you can't walk. Sudden severe headache. This is usually seen more in hemorrhagic stroke when there is a blood vessel that bursts, and usually due to hypertension. Then sudden trouble in seeing. So you could lose vision on one side. And then one-sided weakness. You can't move your arm. You can't walk because you can't move your leg. So all of these are really serious, and these develop pretty quickly. So that's why it's very important that we understand and recognize the signs and symptoms of stroke and ask for help immediately. Don't wait. So it's important to recognize the symptoms. If you do not know with certainty whether your loved one is experiencing a stroke, but you do not have to wait for medical attention. Ask for help as soon as possible. If EMS comes and they determine that you don't have stroke, this is okay. A lot of times we have what is called a TIA or mini stroke, in which the symptoms do not last long and symptoms are not as dramatic, but that is still a stroke. It's called transient ischemic attack, in which a blood supply was cut down to a certain part of brain for brief period of time. It's usually less than 2 hours, but can last up to 24 hours. Most of times it's less than 2 hours, but still that is important to know because many mini strokes can increase your future risk of a full-blown stroke. Act quickly. Remember, this is an emergency. Time is of essence with stroke. The more minutes that pass, the more likely that you're going to have a permanent brain injury and disability. Rapid treatment certainly can preserve a lot of brain function. And confirming the diagnosis is important. If somebody is having the symptoms, they need to seek care as soon as possible in the emergency room. That's where the care would be done. CT scan or an MRI can detect the area where you have a problem, the area of bleeding. CT scan is usually done for that, or MRI is done, if there's any clot, that can also tell us, the area of the damage in the brain. So these imaging studies are important. These are done in the ER, and medical monitoring during the recovery can also help you avoid potential complications of stroke. And of course, recovery is much better if you get immediate help. So remember, anybody who's having these symptoms, please seek help as soon as possible. Other health conditions that can mimic the symptoms of stroke could be migraine headaches. I mean, severe migraines can make you kind of feel like you're losing vision. You could feel some weakness, but it is not as dramatic as in stroke. Seizures. A mild seizure may present solely as a numbness or a tingling or a weakness of arm or a leg. But after a severe full body seizure, a person can also feel weakness on one side of the body. Again, imaging is required. We certainly cannot make a diagnosis just by looking at a person and by history sometimes. So, it's important to go to the ER and, have a solid diagnosis. Brain tumors can pretty much present like that because brain tumors have mass effects. So they can actually put pressure on one area of the brain. And if they are compressing a certain area of the brain that controls the movements of the limbs, you can have feeling of, weakness or a loss of sensation in that part of the, limb. And it can also cause changes in the vision and changes in the speech. But with brain tumor, usually what happens is these symptoms may persist, whereas in stroke, these symptoms do not last for very long. Bell's palsy, again, very, very similar to stroke. It can really mimic stroke very closely. In Bell's palsy, this is a weakness of the nerves of the face, and it usually affects one side. In fact, a lot of patients that we see in the clinic, they may come to us because they had Bell's palsy, or they usually call us when they have Bell's palsy and they think they're having a stroke. Bell's palsy, I don't know if you guys have ever seen a person, they lose functionality on the one side of the face, but they do not lose vision. They do not have weakness of the limbs. So remember, this is a problem with the facial nerve only, and it doesn't affect, side of the body, but it does affect one side of the face. Multiple sclerosis, this is an autoimmune disease. Flare-ups can produce very similar symptoms like stroke, and this is an inflammatory injury to the brain. Diseases of the eye, glaucoma or retinal tears can cause sudden loss of vision that really sometimes it's hard to understand immediately if this is truly stroke or, something to do with the eye. Inner ear problems and sometimes even severe flu can make you feel dizzy, weak, and lose balance, and that can mimic stroke-like symptoms. So anytime you're having these symptoms, please seek immediate medical attention. And then sometimes stroke is so sudden that patient kind of wonders what just happened. And that's why again and again, I'll tell you, it's important to understand and recognize the symptoms. Now I'm going to tell you a little bit about effects of stroke on the brain. If there is damage on the left side of the brain, it can cause difficulty in speaking, understanding language, memory problems, trouble reasoning, organizing, mathematical or analytical skills are affected, and then their behavioral changes. Left side of the brain controls the right side of the body. So if there is a stroke on the left side of the brain, right side weakness is going to be predominant. If front of the brain is damaged due to stroke, this is going to cause now changes in intelligence, movement, logic, personality traits, and thinking patterns. If this area of brain is affected, it makes planning very, very difficult. And I think most predominant symptom that we see in frontal brain damage is actually personality changes. I mean, all of a sudden the person loses, not only just intellect and analytical skills, all of a sudden this person, usually who was a shy person, can become a violent person and loses a lot of their inhibitions because now that control is gone. So I have seen some patients who've told me my father, kind of now behaves inappropriately. And when you dig deep into the history, it's because they have this frontal brain damage. Remember, right side of the brain damage is going to now affect left side of the body. And again, you can have loss of attention, focus, memory problems, trouble recognizing the faces or objects, even when they're familiar. So this is a big problem. Like you kind of lose this sense of shape, right? So you can't now tell if it's a circle or a square, so which is a big problem for people. They can't, understand what does a square mean and how does a line or a circle feel. And it also results in some behavioral changes like impulsiveness, inappropriateness, and depression. So remember, some of these symptoms or signs of the strokes kind of overlap on the different sides. But just for you to remember, left side of the brain controls right side of the body and vice versa. So if somebody is right-handed and has a left-sided stroke, it can really change your life because now you've lost the functionality on the right side of the body. So other effects of stroke on the body are memory problems. You have difficulty in thinking and remembering. You have vision problems, once you lose your vision, the world becomes dark. It's hard for you to, stay functional. Poor eye and hand coordination. This is important because now you can't eat, you can't dress yourself up, you don't know where the mouth is and how you are going to put food in the mouth. So, basically these people become disabled because of their stroke. Then less emotional control. These people, inappropriate behavior, they don't know when to cry, laugh, so they lose control. And then difficulty in making decisions. Once you have stroke, then you lose most of your ability to, manage your finances. And basically, all I'm trying to tell you is this is a very serious condition. It can change your life. You are not going to be functional. A lot of people become disabled. But there is hope, and I'm going to talk about that after I'm done with these. So movement and sensations are affected. Messages don't travel properly from brain to the body. So remember, brain is your command center, and now you don't getting those messages from your command center to do certain things. So you have paralysis, you have muscle weakness, and then incontinence. You lose control of your bowel or bladder. And think of a life where you have to wear pads, and you just lose a very essential, activity of daily living. You can't do it. You have to depend on somebody who will be changing your diapers. Nerve problems, certain nerve groups may be damaged. Patients may not feel any pain or feel more pain. And then sometimes they have this, you feel more heat or you feel more cold or you don't feel anything. So that either thing can cause a lot of problems. If you don't feel temperatures, you could really touch a hot area and then can, get burned easily. So, those are the things you have to be really careful with these patients. And speech issues, it's a big thing. Think about your inability to communicate with somebody. You want to say something. You know what you want to say, but you just can't say. And that's a big problem because the speech becomes slurry. And that could be, in some people, one of the first symptoms of stroke. Eating and swallowing is a problem. Because you've lost that control, then people can have paralysis of throat and tongue and mouth. So these people are at very high risk of what we call aspiration pneumonia. Initially in stroke, these people pretty much go on, pure diets because solids, it doesn't go in their food pipe. It may end up in their, windpipe or trachea, and it can go to their lungs and cause infection. So this is a big problem, aspiration pneumonia in these people. These people can only eat when they're sitting upright. They can only eat certain consistency food. So it basically changes your whole life. And recovery is a long process. Rehab after a stroke begins in the hospital, of course, because this is where you're going to get initial care. And often within first 2 days of getting a stroke, rehab can help ease the transition from hospital to home and prevent another stroke. And stroke rehab is a kind of multifactorial approach. You have to do speech therapy. These people have to, be kind of retrained to talk. These people need physical therapy because we have to retrain your muscles to be able to do their things. And ACMED, on your activities of daily living, basic hygiene, eating, drinking, reading, writing, the things that, make us a normal functional human being. You've lost all that. The good news is that a lot of these people can recover if the intervention was done at the right time and you made it to the hospital in time with a full-blown stroke and you got good, rehab. I think I've seen a lot of people who recover very well after that. So this is the kind of things just spend a moment to look at this slide. This is what you lose when you have stroke. And this is pretty much, in my mind, losing your ability to have a life. This is when you really, you are a living being, but you really cannot do most of the things that make us a functional human being. So who is at risk? I think whenever we talk about any disease, it's important for us to know that prevention, you should know what you could do today so that you do not end up with some of these conditions like stroke. So stroke is not just, it doesn't just happen. There are things that increase your risk of having that stroke, and this risk increases over time. Remember, I told you age is a risk factor, but then there are other risk factors like having high cholesterol, which is not treated, having high blood pressure, smoking, and having diabetes. So it's important to understand and manage those risks. First and foremost, controlling your blood pressure. Number one underlying cause of having stroke is blood pressure. Whether you have hemorrhagic stroke or ischemic stroke, it's your blood pressure that really leads to that stroke. Unmanaged hypertension can damage the cells of your arteries and cause hardening of the arteries, called atherosclerosis or plaques in the arteries. These can block the blood flow to your heart or brain, kidneys, and even your muscles. So remember, if the blood flow to the heart is blocked, this is heart attack. Blood flow to the brain is blocked, it is stroke. And then kidney issues can cause chronic kidney disease or kidney failure and muscle weakness, as I told you. Another thing that accelerates your risk of having stroke is smoking. Anybody who smokes, or if you have a loved one who smokes, the one thing that you have to do is to quit. Smoking is a carcinogen. It increases your risk of cancers, but it also accelerates the plaque buildup in the arteries that eventually leads to heart attack and stroke. So, there is no health benefit of smoking. This is something that you must do. It requires some willpower, but then there are medicines that are available that can help reduce your cravings. So if you smoke, you just need to stop smoking. In fact, most of the people with hypertension who are going to get stroke are usually smokers. Then managing your cholesterol level is very, very important. You should know your numbers. When you see your primary care doctor, you should know what is your bad cholesterol, what is your good cholesterol, what is the ratio between total cholesterol and good cholesterol. Because this cholesterol is also one of the substances that leads to the plaque buildup in the vessels or the arteries that supply your heart and brain. Then diet and exercise really is important. If you follow a healthy, low-salt diet and you are physically active, you can significantly lower your risk of heart disease, high blood pressure, diabetes, and many other chronic conditions, including several cancers. So it's something that has to be a part of your life or part of your daily routine. We tell patients all the time, and I can also promise you, people who follow good diet and people who exercise not only reduce the risk of developing hypertension or diabetes and eventually heart attack and stroke, they also even if they have hypertension or diabetes, they manage those so well with lifestyle changes and of course sometimes medications that they are really going to lead a normal healthy life like somebody who does not have those conditions. So even if you have those conditions, you can manage those very well. Managing your diabetes, of course, is important. When you go see your doctors, they check your sugars, and if you're pre-diabetic or diabetic, you have to take care of yourself. First thing, again, is going to be going on a better diet, decreasing processed foods from your diet, and exercising. And of course, if you're at a certain level, you could go on certain medications, and your physicians can, formulate a treatment plan for you based on your numbers. And if you have been asked to take the medications, it is your responsibility to take the medications like you've been asked to do. Most of people who have stroke, honestly, are the people who really had high blood pressure but stopped their medications. And hypertension is called a silent killer because when you have high blood pressure, you usually don't have symptoms. And it's heartbreaking in ERs when sometimes patients would come with a stroke, and that was their first symptom of knowing that they had hypertension because they never went to the doctor, didn't get themselves checked, and now they have stroke, and it's completely changed your life. Then avoid recreational drugs and too much alcohol. Alcohol consumption leads to increased blood pressure, and illegal drugs, of course, these are stimulants, cocaine and methamphetamines can cause stroke. Young people, if they are drug abusers, they get stroke even though they do not have hypertension. So that's because of recreational drugs. They're going to have a heart attack. Cocaine is a known risk factor for having heart attack in young men. In fact, when a young person less than 40 comes to ER with a stroke or heart attack like symptoms, doctors pretty much know that's a drug abuser most of the time. Then start early and stick to a plan. I have told you all about the disease and the symptoms and signs, but my take on this is prevention. If you could prevent one stroke, I think that is amazing, because you have not only protected a person from getting sick, you have prevented a person from becoming disabled, and that is very, very important, because a lot of these people with stroke live with disability. And preventing stroke and preventing heart disease is most effective when started in midlife or early in life. I would even say, if you have kids, you have to make sure that they are not on too much processed foods and too much junk food, because that's where atherosclerotic process or plaques in the arteries start building up. In kids as young as 10 years of age, studies have shown that they can have plaques in the arteries. And controlling blood pressure may reduce your risk of dementia later in life, and that's a known fact. So remember, with your healthy eating, your exercising, simple things, simple changes in your lifestyle can lead to, positive changes for later in life, and then also decreasing your risk of all the bad things that will, make you probably disabled. And then this brings me to end of my discussion, and I am open for any questions that you may have. And I have a few people in the room. If they have any questions for me, I can start off here.
Okay. So we have about 10 minutes for questions and to wrap up. So thank you so much for that presentation. That was really, really wonderful. I felt like I knew a good amount about stroke awareness and prevention, but even I learned some new things. So I'm sure everyone else can say the same. The first question that I have for you is, when you mentioned in the beginning of the presentation about symptoms and recognizing symptoms, you said get help right away. I'm assuming that you would mean like call an ambulance or go to an ER, not like an urgent care, not your PCP.
Yeah, so that's very important, right? So if you lose function of a limb, like you cannot pick up a pen now, or your speech is slurry, you're not calling a doctor's office, you're calling 911. That is something that everybody has to recognize, especially older person with underlying, history of high blood pressure or diabetes. You have that, you are calling 911. Sometimes patients would call us and say, okay, I had this severe headache and I felt numb for a while, but then it became normal. Those are the patients you could call a doctor's office, because that could be multitude of things. And remember, I talked about TIA, which is transient ischemic attack. We do see a lot of those people, but there's really not much you could do for them. And, in the ER at that time, because by the time you reach ER and you have no symptoms, these doctors are not paying attention to you, right? If you have a stroke-like symptoms, you're getting right in and they're starting on the treatment right away. But if something like this happened, like I lost, muscle strength, but it's very different. In stroke, it's very, very dramatic. It's progressive, it's quick. Whereas in other things, it could be, I felt like I was weak, but then I asked my patients, can you hold a pen? Can you hold a cup? If they say yes, that's fine. In stroke, you're just like boom, you're just down. There is no strength. That is a little bit different than other things. And if you say, I felt like words didn't come out right for a minute, but then I got all my speech back, that's probably not stroke, honestly. So those cases, you are highly functional, you could call your doctor's office. Or if you walk into an ER, they are not thinking you have stroke, because if you have a true stroke, you can't do it yourself. You are asking for help. So a lot of older people, they have those bracelets, right? Safety bracelets that they can, call 911. And that's what our high-risk patients, we make sure that they have those. And especially after you had your first stroke, and if you are at home alone and you feel like something is not right, you switch that button, you push that button, you need help immediately.
Thank you. Another question that I have is, after having a stroke, you're started on medication. Is that something that you have to take for the rest of your life? Or if you make lifestyle changes and there's improvements seen, is it something that you could maybe wean off?
So there are different treatments for different kinds of stroke. For somebody like hemorrhagic stroke, they have to make sure it's usually, I said, blood pressure, right? That's how the blood vessel burst open. And in some congenital malformations in the brain, blood vessels can lead to that hemorrhagic stroke. But those people usually would be on some kind of blood pressure medicine for the rest of their life. People with ischemic stroke would be probably on something like a blood thinner for the rest of their life, because sometimes it's a blood clot that went in the brain. So depending on the type of stroke, but most of these people will end up on some kind of medications for the rest of their life. Most of these people will end up on cholesterol medication for the rest of their life. Certain things, they will not need as much for the rest of their lives, right? If you were started on 3 different blood pressure medicines, but eventually you'll probably end up on one as your numbers come down and you've improved on your lifestyle. But some form of medication you would be on for the rest of your life.
Thank you.
And in that case, remember, it's more, we tell patients, this is more prevention. We are preventing another stroke. This is, don't think of it like I am on so many medicines. This is to prevent another event.
Does anyone in the room have any questions? So if you are online, if you have any questions, you can enter them in the chat, or you can feel free to unmute yourself to ask your question. The final question that I always like to end with, and maybe one will come in, maybe one won't, is if you wanted us to walk away with one piece of information today, if we didn't remember anything else, what is the one thing that you would want us to take away from this?
One thing I would want all of you to remember is life is precious. Take good care of your health. See your primary care doctors, do your annual physicals, know your numbers. That is one thing you should know. If everybody knew what their blood pressure is like, if everybody knew what their sugar level is like or cholesterol is like, we can prevent half of this. I mean, stroke and heart attack, in my mind, are preventable diseases. In most of the cases, I'm not saying 100%, but for most people, we could prevent this. And prevention is very, very important. So go see your primary care doctors, take ownership of your health. And if doctor tells you have to take a medicine, ask all the questions that you have, but take your medicines. Remember, I told you stroke happens when patients stop taking their medicines.
Thank you so much for that presentation. That was really wonderful. If you're like me and you walk away from a presentation and then realize, a day later that you have questions, you can always reach out to the Women's Fund at healtheducator@thewomensfund.org. And we can get answers to any questions that you have, or if you have any comments, suggestions for topics, anything like that, we would love to hear it. I will be sending out an email following today's presentation with a link for a survey. We'd greatly appreciate if you would take a few moments to complete that for us. I will also include in that email a link to our website as well as our publication page if you're interested in any of our publications. And then lastly, there will be a link to our membership luncheon for this Friday. We are going to be having Dr. Juliette Breeze speaking on the topic, Know Where to Go, Good Medical Decisions for You and Your Family. It is a membership luncheon, so there is a fee associated with that, but we will likely be live streaming on Facebook during her presentation. So if you're interested in tuning into that, we will have that on our Facebook Live. Other than that, I want to thank you all for tuning in today, and I hope you have a great rest of your week.
Thank you.
Thank you.